Hi, my name is Histology. Today we'll look at the stomach histology using a digitized slide that we have here, and we'll cover the mucosa, cell types, muscle layers, and physiology of their secretions, and how the stomach histology changes from fundus to pylorus. And we'll look at the other slide that we had done the other day concerning the gastroesophageal junction, so that we can just identify or understand how the histology of the stomach changes from the fundus all the way to the pylorus. So, as we know, the stomach is a muscular organ that's specialized for food and storage and digestion. So histologically, it's lined by simple columnar epithelium. Okay, let me just show you how it looks. The simple columnar epithelium here at the surface, and these are actually mucus cells. So when you look at the simple columnar epithelium, especially the mucus cells here, you notice that the nucleus is more basally located and the cytoplasm is more located above the nucleus. And if you notice, when you look carefully, let me just go in a little bit higher at high power, you notice that there are some lines here. 1, 2, I can see 3 lines, but most textbooks show 4 lines. But in actually dysplasia, you lose this outline, and sometimes the nucleus can go upwards, but in normal histology of the stomach, we get to see that the nucleus is basally located, and this is what we call a foveolar type of epithelium, or gastric foveolar epithelium, with these foveolar pits here that we see. Let me show you, just zoom out so you can see a pit there, another pit. These are gastric pits. So the function of the surface here, as you can see, the mucus cells, is to maintain and protect the stomach lining from the acid that the specialized gastric epithelial cells produce. Okay, and then the lamina propria, you can see this is the lamina propria here, the spaces between the gastric pits here, with multiple lymphoid tissue cells. There's lymphocytes here, which is normal, and you get to see them in your normal stomach histology slides. So let me try and show you how this, for example, this gastric pit here and this gastric pit, what's between these two here, these cells here, is actually the lamina propria. And then this here are lymphocytes here, which I'm highlighting, with some having maybe a plasma cell. This is a plasma cell, another plasma cell, but lymphocyte. This is normal actually in stomach histology. So as you can see, the mucosa extends from surface epithelium all the way to the muscularis mucosa here, and consists of foveolar epithelium, lamina propria, and muscularis mucosa. And like I always mention, the muscularis mucosa is lined by smooth muscle fibers. And how do we know? Because they have a cigar shaped here nucleus. Okay, now let me just highlight parietal cells for you. These are other specialized type of gastric cells. So how do we know that these are, how do we identify parietal cells? They are mostly have abundant pale eosinophilic cytoplasm, and sometimes they can have a fried egg appearance, like here. Okay, so, and if we can remember, the function of parietal cells is to secrete hydrochloric acid via the hydrogen potassium ATPase pump, and they also secrete intrinsic factor. And if you remember, intrinsic factor is important for vitamin B absorption in the terminal ileum. So parietal cells are activated by a hormone produced by endocrine cells called gastrin. So we can also find enteroendocrine cells. They have can I say pale, or we just call it pale eosinophilic cytoplasm, or sorry, pale cytoplasm, like a clearing around the nucleus. If I could just find one nice clear one, just to show you, like this one here. This is an enteroendocrine cell. And remember, enteroendocrine cells, like I mentioned, produce gastrin, which helps with secretion of the hydrochloric acid and intrinsic factor of the parietal cells, and they also produce CCK, which is cholecystokinin, and substance P, as well as somatostatin and other prostaglandins. Okay, and then just next to the parietal cells, we actually do get Schiff cells, which are more basophilic. They have a basophilic cytoplasm. Let me just pick up one for you. Okay, like here. I think we have quite a number here. So as you can see, they have a basophilic cytoplasm. And the reason why they are more basophilic is because they contain more endoplasmic reticulum, or more rough endoplasmic reticulum. And Schiff cells actually secrete pepsinogen, which is stimulated by the acidic environment. Okay, so as we now go deeper, so this is a parietal cell, just a quick one. Parietal cell, Schiff cell. This is a nice slide. So parietal cell, Schiff cell, enteroendocrine cell. You can see the cytoplasm is almost getting cleared. If I could just find a nice enteroendocrine cell for you, I think I would be very happy. Okay, but anyway, I'll pick up one as we go forth. This here is the muscularis mucosa, and deep to the muscularis mucosa, if you remember, like other gastric organs or gastric alimentary canal organs, they have a submucosa. So in the submucosa, we get to see blood vessels, and that's where the myenteric plexus actually is. So you get to see multiple nerve tissue. So like here, this is nerve tissue here I'm highlighting, which could be part of the myenteric plexus here as well. And they are involved in churning, which help the muscularis externa of the stomach, which I will now begin to talk about. So in the muscularis externa, or muscle portion of the stomach, we have the inner oblique muscles, which are smooth muscle. Okay, so the inner oblique, and then we also have the midossecular layer. Okay, it's going to be hard to identify that this is oblique and this is secular. Okay, but this is an oblique, midossecular, and outer longitudinal. I think the outer longitudinal is much more, it's easier to identify because you can see how the nuclei are arranged. So you can see they are more longitudinal with the classic cigar-shaped nuclei appearance. And then when we go into the midossecular, you get to see the nuclei are more secular because they're cut at transverse section. And then we get to see the oblique, maybe you may see kind of like a slanting. So this is involved with churning and may be controlled by the myenteric plexus, the nerves that are in the submucosa. Now if you remember, in the stomach, like I mentioned, the fundal area to the pyloric region, the histology kind of changes. So you get to see more of these parietal cells and Schiff cells in the fundus and the body, and as you go down towards the pylorus, you get to see the reduce. So let me just, if you remember this slide, the gastroesophageal junction. So remember from the esophagus here, which is where we are, if you remember, it's lined by stratified squamous epithelium, which I'm showing here with the mouse. And then as we go down into the stomach, we enter the fundus. So like if you remember what I just said, the fundus consists of more parietal cells, which is what you expect to see here. More fried egg with appearing cells with abundant eosinophilic cytoplasm here. And I think probably here we can pick up a clear interendocrine cell. I really want to show you one nice clear one. Maybe I'm just unlucky to, here they are. You can see the cytoplasm is more eosinophilic, it's more clear, sorry. Yeah. Okay, so now what are there are some small clinical pearls that we need to know concerning the stomach. Okay, so one of them is, I'm showing in the clinic, the doctor may prescribe NSAIDs. So remember, your NSAIDs inhibit prostaglandin secretion, and this actually reduces mucus production here in these foveolar cells here at the surface, and can actually predispose someone to getting a gastric ulcer. And if you remember, hypergastrinemia, something like Zollinger-Ellison syndrome, which is an excess acid secretion, and can actually also predispose you to gastric ulcers. And then, like I mentioned, remember intrinsic factor, which is secreted by your parietal cells. Intrinsic factor aids in absorption of vitamin B12, and if you for example have a portion of your stomach cut and you lose a number of your cells that produce intrinsic factor, you can actually develop a vitamin B12 deficiency, which can actually be very, very detrimental unless you replace the patient with vitamin B12. And I think we can end here because I think we have talked about everything. Anyway, just a recap. So stomach, this is the mucosa, this region here. Submucosa, muscularis externa. Okay, in the mucosa we have mucinous cells, which are more on the surface, and then parietal cells. How you identify: fried egg appearance with eosinophilic cytoplasm, chief cells, and interendocrine cells, and then your muscularis mucosa, and then submucosa, and muscularis externa. So that should be easy. This is one of the easiest organs that you can understand, the stomach. And I hope you enjoy the video, and please like and subscribe for more histology content.